Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Podcast Studio. And we are super excited to have another fellow functional medicine, freedom-loving pharmacist on our podcast, Dr. Fadwa Gillanders, and she is going to introduce herself and tell us her story. So, Dr. Fadwa, welcome to our show.
Hi there. Thank you for having me. It's truly an honor. Truly an honor.
Yeah. Well, tell us, I introduced you really quickly, but tell us a little bit about your story and how you got here to be here on this podcast.
Oh yeah. So that's gonna be a long story. So no, hopefully not.
That's all right.
Hopefully not. So many years have gone by. I've been a clinical pharmacist for 25 years. I used to work for Henry Ford Health System. I quit in September of 2023, and I've been with them for 25 years, both inpatient and outpatient, as well. And I say outpatient was mostly ambulatory care, and working on adult internal medicine, chronic disease, and then I did a lot of managed care for them. Majority of the time that I was there, but it was very clinically sound. I was assigned to about 80 physicians that worked closely with them and had meetings with them. We did initiatives and so forth together. So it's been a great career, but 5 years into it, I started noticing some things that just didn't seem to align. I started noticing, peanut allergies that I didn't grow up with. I started noticing gluten allergies that I didn't grow up with. Mm-hmm. Because my specialty is in adult chronic disease, us pharmacists, we read the whole study, right? Mostly the MDs read the abstract, but when I would go on rounds with them, and read the studies, the relative risk reduction for, your first event of a heart attack or a stroke, depending on the drug that was being studied, was always at like 32% constantly. And we were like adding a new drug, ARBs came out, during the time of my tenure. And so we're like, okay, change from an ACE to an ARB, add the beta blocker post a heart attack. Let's get the aspirin on board. Yep. And then, we started seeing the evolution for diabetes, right? We went from like insulin, sulfonylureas, metformin was, and still is quite an innovative drug. And then we started going to the TZDs and you started seeing some side effects from these other agents. I didn't see more improvement happening. I just saw more patients either gaining more weight, feeling more fatigued. The good thing is that when the physicians would assign these high-risk patients to me, when I got a chance to get to know the patient more, we can do some diet changes. I got a chance to know more about their lifestyle and movement. And one thing that I've seen in the last 25 years, that whatever little positive direction you make, however small it is, your body will give back 10 miles. So I always tell my patient, just make 1 inch, your body will give back 10 miles. And because I was doing a lot of managed care, I was there at the time with dealing with co-payments. And we're seeing those co-payments rise. We're dealing from a 2-tier system to a 3-tier system to a 4-tier system, and educating patients as to telling them like, okay, today is probably the cheapest day that you're going to ever afford your insulin. Tomorrow it's going to get more expensive. And for them to kind of wrap around, well, I have insurance, and what does that mean for me? And my insurance should be covering all this stuff. Well, your employer is really the insurer, not Aetna or Blue Cross. They're the ones managing the paperwork for your employer. Your employer is the one who's paying the bills, and your employer is the one who's deciding, what is covered and what is not covered, and the insurance company's catering a contract for them. And so that, and I would be very transparent with patients and explain that to them. So then when I was kind of collecting all this data to myself, I finally said, I want to look into holistic medicine. I want to look into supplements and functional food. At the time it was functional food, taking that pyramid and flipping it upside down and looking more at good fats and proteins rather than the grains and the carbs. And I started incorporating like keto diet for myself, and I started seeing a change for myself. And then, have 2 little kids that were born during this time period. And both of them had issues. Both of them had, my oldest had lactose intolerance, and my youngest has glucose sensitivity. And then my husband ended up having diabetes. And when he was first diagnosed with diabetes, we started him on metformin and insulin because I didn't want him on a sulfonylurea, and there wasn't anything else at that time. There wasn't Januvia wasn't out there, and I definitely didn't want him on a TZD, and so we did those two. And his glycated hemoglobin went down to 6, 5.8, something like that, and his blood work started looking really good, but he started feeling worse. And he was more fatigued, more sleepy. He couldn't get any energy. And finally, I'm like, you know what? I'm going to take you to a clinical nutritionist and let's just do a nutritional blood work on you. And come to find out, my husband is very sensitive to gluten, very sensitive. And he was producing no cortisol whatsoever. It was 0. The entire 25, we did the saliva test, 24-hour saliva test, and it was 0. And I felt so bad. I'm like, I don't even know how you got out of bed in the morning. And it was probably the gluten that, caused the issues with the adrenal glands, which also caused him to have diabetes. So once he got on a gluten-free diet, it was the first time in 10 years I saw the color of my husband's eyes. They were open, he was articulating, he was talking, he was engaging. And that's when I started to realize, okay, I'm going to start, studying this on my own. And I started integrating it into the practice with the Henry Ford docs, and they loved it. Integrating vitamin D, just simple things, really simple things, vitamin C, diet changes, talking a little bit more about sugars and gluten and things like that. And I started doing nutritional talks for them. Insurance companies at the time, Health Alliance Plan, I was with them, and they would have me do talks for their employer groups, for the members of the employer groups, and just try to help incentivize them and teach them about diet and certain supplements and B vitamins and things like that. And then fast forward to what happened last 4 years. And I wanted to open up this clinic, Apple Cross Wellness, 20 years ago, but it wasn't the right time. My husband's an engineer, and there was bankruptcy that was happening here in Michigan, and we weren't sure if he was gonna have a job, so I stayed working. Anyways, 4 years ago, when everything hit the fan the way that it did, I started learning even more about biochemistry that I didn't really appreciate prior to that. And what I mean by biochemistry, I mean beyond what us pharmacists know in general of absorption, metabolism, and elimination, right? So that's our 3 main pathways. Can the drug be absorbed? Where is it metabolized in the P450 liver, and drug interactions, and making sure we have safe elimination. But I didn't really appreciate mitochondria at that time. And I started learning about mitochondria and how SARS-CoV-2 was impacting the mitochondria and oxidative stress and hitting those ACE2 receptors. And I always tell my patients, those are the receptors where you lost your taste and smell. That's the most common area. Certainly they're everywhere else in the body, but just for perspective, when you lost your taste and smell, you lost those ACE2 receptors. And so I started learning how to deal with glutathione, and how to help our bodies make our own glutathione, because we can. And I tell my patients, you're just one walking blueberry. You can make your own antioxidants. You can make your own glutathione. Start learning about epigenetics. So I went from functional food to supplements, and now I'm into biohacking, cellular nutrition, focusing on mitochondria and detoxing, safe and effective detoxing. So that's my story. And I'm sticking to it. No, I'm just kidding.
No, I love it. There's a lot going on there. I can think of a couple questions. I'm going to save them after Janet asks you some questions.
Well, to a lot of our listeners, this is probably a lot of terminology. So I'm going to bring it. Yeah. No, it's okay. No, it's fine. It's great. So we're teaching, and it's a great moment. So from a personal standpoint, with your husband, where are you now? Are you detoxing? Is he on insulin? Just kind of tell me where he is with his health, as well as your family, because I think that story impacts people more to see, how we've changed their outcomes.
Yeah, absolutely. So yeah, he's not on insulin anymore, and he only stayed on metformin the entire time, and he stayed gluten-free. And so as long as he's not eating gluten, he's doing great. My husband sits a lot, as an engineer. So he really needs to have more movement in his life, to be honest. We all do. I sit a lot too, as I've been trying to start this business. As far as my daughters, concerned, Elizabeth no longer has to worry about dairy, because when she was little, we started her on probiotics and prebiotics. So she was about 2.5 when all this started, and she stayed on pre and probiotics for years. And now she can, eat ice cream and have dairy and not have, not be vomiting and so forth. And she was very sick, as well as my second one with the gluten. As long as she's gluten free, she's not bloated. She would have dark circles under her eyes. We can tell by her eyes, how she's doing inside. And so when her eyes look clear and there's no dark circles, we know that she's feeling much better. She's more clear headed. And so we're a pretty thriving family. Thank the Lord. In terms of detoxing, like we've taken it up a level. We use a bottle, a particular brand that safely detoxes metals and glyphosates and pesticides and parasites and so forth. And I sent that away with my girls to school, because they're eating junk at the cafeteria. I mean, how do you how do you feed 15,000 students or what have you? It's GMO and and chemicals. So my girls are on this product called Clean Slate, and they also take nootropics to help them stay focused, stay calm, deal with oxidative stress, while they're in school. I take them for myself for the same reason, and so does my husband. So our routine is more cellular nutrition, giving our cells the food that it needs in order for it to have appropriate cell talk inside our bodies, right? Our cells like to talk to each other. As pharmacists, we were trained in terms of like a cell glove response, right? Like the drug looks like this, the receptor looks like this, we fit it together, and we activate something, either lower blood pressure or lower blood sugar. But technically, the body doesn't really like to speak in this way. The body rather speak through your DNA, your own mathematical DNA, and be able to deal, I always tell my patients, we want to make a beautiful symphony inside your body. We want your body to sing and make beautiful music. So, the liver is talking to the fat cells, and the gut is speaking to the muscles, and the pancreas is speaking to the fat cells, and, what have you, to the brain, the gut brain axis, that whole thing. That's all cell talk. And that's where I try to focus my attention now, holistically.
I love your story, and so much going on. Go way back to when you talked about peanut allergies. I like to, maybe use the analogy like you did with your daughter being lactose intolerant. And if you think about this, years ago, decades ago, 50 years ago, there were not that many people with peanut allergies. Remember when we were growing up, Fadwa, in an elementary school of 1,000 people, there'd be one person that might have peanut allergies. And now I don't know the numbers, but it's a high percentage. And I think it tells you part about our food supply, for one, and our immune systems. It's just like dairy. Let's face it. Generations and generations ago, centuries and centuries ago, almost every culture, ate dairy. So there is no reason we should have lactose problems in our body. And the only reason it is because we're not exposed to the right things at younger ages. And I think in some ways, when we tell parents, oh, don't feed your kids dairy for at least 1 year, or, stay away from peanuts. Well, if you tell people that, then of course they're not going to be able to tolerate it. What is your comment on that?
No, I agree. I want to answer it in two ways. Back in the day, that is an appropriate response. If you don't expose early on and allow for appropriate microbiome production in the intestinal tract, which is why we promote breastfeeding, right? We want that colostrum, we want appropriate breastfeeding and so forth. But today's food, even if you were to start with milk, you better go see a farmer before you go and buy it in the grocery store, right? It's filled with sugar and it's pesticides. So I don't even know if they can tolerate it, even if you wanted to try to expose them to that. And then peanuts have a lot of mold on them. And so I think that's where we're getting a lot of those allergies, is really from the mold component of that. So now it's almost, grow your own food, be able to see a farmer if you can and know how they're growing their food. And I agree with you. I think if you start young with good nutrient food, it hasn't been sprayed upon or what have you, they should be able to tolerate it.
Raw milk.
Yeah, raw milk. Yes.
Janet grew up on it.
Oh, man.
Well, we also have the component, we use antibiotics like crazy. And so if you've wiped out the gut, it's already setting us up for a problem. And then we have the food sources on top of it. So there's multiple things happening at the same time.
Yeah. As a matter of fact, one of my jobs as a managed care pharmacist, when I would present to my physicians, was always about antibiotic resistance. And I was constantly telling them, if your patient's coming in with a runny nose, I mean, not that I'm an MD and I'm not in that office. I'm not trying to say like I'm diagnosing your patient, but majority of the time the data is evident, it's viral. And so by giving them an antibiotic, you're not behooving that, you're not benefiting anything. And at the same time, you're killing off their microbiome. And now we have glyphosate, and glyphosate is in our water, and glyphosate is a huge chelator, huge microbiome killer. And we have bacteria that's trying to fight for us. And so when you get rid of it, you're kind of left exposed with sickness and disease. Absolutely. And resistance.
Absolutely. So changing gears a little bit. Back when you started being a clinical pharmacist and working for these clinics and managed care companies. So I want to educate our listeners and viewers about how that is driven. And I guess what I'm saying is how are doctors and pharmacists that work under doctors incentivized by insurance companies to make sure drug therapy is appropriate? Can you comment on that? Do you know where I'm going with that?
To make sure drug therapy is appropriate? Well, I can tell you for me, in the 25 years that I was doing managed care, I was very thankful that the team that I was with, we made it very clinically sound. We made sure we taught our physicians why we're antibiotics, for example, is a big spender. You spend a lot of money, thousands of dollars on antibiotics. And so to educate them when to use them and when not to use them, not because of the money situation, but because there's antibiotic resistance situation. So every time, or proton pump inhibitors and examples like Prilosec, Protonix.
Yeah.
We were teaching them about that. They were very expensive back in the day. You can buy them over the counter now, and they're still expensive over the counter. But the point is not so much about the money as number one, but safety and efficacy as number one. And then you look at the dollars as number 3 or 4. And my docs had a hard time connecting those dots. They just kept saying, well, you're just the drug police. You're hired to, make things cheap. I'm like, no, I'm trying to tell you that if you keep your patient on Protonix or Nexium or Prilosec or any of these drugs, you're reducing their pH level of their gut. They're not going to be able to digest food very well. You're pulling calcium from their bones. It's interacting with their blood thinners. Long-term use of these drugs does not behoove them. And so it's not about the money. So I kept making it very clinically sound for those 20 years. And I actually was trying to save their job, really. And when I say saving their job, I started to really learn about socialized medicine when the Patient Affordable Care Act came into play. And when we started Medicare Part D came into play. And when you allow the government to provide you a service like medical coverage, same thing like the employer, they're going to tell you what you can and cannot have. So I really took I really took that to heart. So I shifted gears. So even though my docs would give me their high-risk patients, and it was an honor and a privilege to work on those patients, I focused all in on physicians. And I wanted to teach them what socialized medicine is about, what they're being forced to do, what measured outcomes they're being forced to ensure that they meet, like bone density exams or certain screening exams, or making sure a diabetic was on a particular drug or what have you, and how to help them look at their insurance formulary, how to help them get off some of these meds so they're not dealing with paperwork all the time, denials and appeals and so forth. Because in the end, we're all sharing that pot of money. And we have to learn. I hope I'm explaining this appropriately for your audience, but insurance does nothing but control your choices. Mm-hmm. And patients get frustrated with that because they think I have insurance.
Yeah,
it should cover. And it's like, no, you paid into a pot with everybody else, and you're all responsible for everybody else. I have coverage for prostate exams that I'll never use, right? And
right.
Men have coverage for gynecological exams that they'll never use. Right? Yeah. We're all sharing in this pot. And so I really took the time to try to educate my physicians to take a look at, when you're ready to prescribe something, think twice about it. Is it necessary? What are the outcomes that I'm looking for? Can my patient afford it? Is the risk worth the benefit type of thing? And if you don't know the answer, come get me, because I was just down the hall. And so I tried my best to sound the alarm of appropriate clinical sound treatment, integrative medicine with some of the supplements that I was helping them with, but at the same time, really thinking about the budget and really paying attention that you're going to be, the noose on your neck is going to get tighter and tighter if you don't learn how to manage your practice.
Yeah, we're talking about managed care. We're talking about socialized medicine. We're talking about insurance and employers dictating people's health care. And you're talking right up our alley. You may know that I wrote a book called Sickened, How the Government Ruined Healthcare and How to Fix It. And you'll get a copy being a guest on our show. And here's the reality, and this is why I'm glad this got brought up, is that, there is no employer, there is no government plan, there is no healthcare plan that is going to care about your health like you would. Right. So the ultimate fix to this whole problem is that patients need to be educated and empowered to take charge of their own health.
Right.
100%.
100. I used to tell my patients it's cheaper to eat the carrot. Back in the day, it's so much cheaper to eat the carrot. And I had a patient one time. She was on a government program for her medications. She was on 15 meds. Many of them were really cheap. One of them only cost $1. And she was only 30 years old, and she was dealing with fibromyalgia and depression. This was about 15 years ago. And I was helping her, go through her meds. And I said, so you can't even afford $1? And it wasn't judgment. I wanted to know where she was at mentally and what was going on. And she said, no, I can't even afford $1. And I said, well, I'll tell you what, I'm going to help you get these meds, and I'm going to teach you how to use them. And we're going to try to get you off of them as much as we can. But do you have a plan B? And she said, I don't understand what you mean, Dr. Fadwa, about a plan B. I said, well, do you think you'll always have coverage forever? Free coverage forever? And she said, I never really thought of it that way. I said, no, you got to have a plan B. You have to realize that this is just a bridge. This is just temporary. You're getting some temporary assistance right now. What are you going to do for yourself so you're not shackled and having to be desperate, hoping another program might cover you or you might get approved for? She called me 2 days later, and she said, that conversation changed my life. She goes, I had no idea what I got myself stuck into. And I never followed up with her after those 2 days, but I pray that she's, a thriving, 40-year-old right now, and not on those 12 medications that she was on at the time, although she was getting them for free.
Well, and that's part of the problem is that, when you get something for free, then there's no value there. You don't really care what they cost. So the price, even though her meds were cheap, you said, the price could be astronomical. That's one of the reasons that our healthcare prices have went up so much inflationary wise, is because, the individual consumer is not paying for it. And then you don't think about the consequences. Mm-hmm. But really, like you said, it's when you educate them, and I'm taking this directly from Sean Baker, author of The Carnivore Diet. Oh, yeah. We interviewed him a couple weeks ago. It's our second interview with him. When you educate people about, being on a drug to treat some disease that is lifestyle caused, i.e. diabetes is a great one. It's very disempowering. I mean, think about that from a patient standpoint. I am going to be a sucker to this drug the rest of my life. I've got to find a system, either me personally, usually not, or some other system for me to pay for this, or I got to figure out a way to get off the drug. So if you are stuck taking that drug the rest of your life, it's very disempowering. If you want to empower somebody, teach them how they can reverse their diabetes. Teach them how they can reverse their reflux and get off those drugs. That is how you empower people.
100%. That's why I said, so when my patients feel overwhelmed, and they realize, I'm not going to be able to sustain this. Like inhalers, for example, for asthma are very expensive, even with the copay, and so are the diabetic agents. So I take them from overwhelmed to, where are you at? Where are you at right now? What can you handle? What can you do? What little things can you change? For example, I had a patient that drank 12 cans of Diet Coke a day. Like he legit drank 12 cans of Diet Coke a day. I said, well, can we make it 11?
Yeah, right.
And he's like, yeah, I could probably make it 11.
Right.
I'm like, because believe it or not, that one less can of Coke gave your body a little, a reprieve. It had one less can that has to deal with metabolizing and figuring out what to do with it. So I would take patients from where they're at and encourage them. Again, you give yourself 1 inch, your body will give you back 10 miles. You don't have to solve this all overnight. And before you know it, a year from now, 2 years from now, you'll be a totally different person, and without having to feel the angst and the stress of, I got to do this today, and already set yourself up for failure. And so I work really hard at taking away the overwhelm, encouragement, and hope, because you know what? We are truly fearfully, wonderfully made beings.
Absolutely.
We are, and we're quite resilient. And so when they start to hear that and feel more motivated about that, and then start seeing their bodies change, it's very exciting.
Well, and considering that most of these chronic disease drugs have been really made in the last 30 or 40 years, to think that our body needs those to survive is ludicrous. Right. I mean, if we eat the appropriate food, we sleep appropriately, and we get the appropriate movement in our body, we basically give our body the right input, we can thrive without any drug therapy.
Right. And also taking away the worry of them paying cash. Like you guys are a cash-based pharmacy, which is fantastic. And then, paying cash for their supplements. They don't realize they're actually saving much more money this way than their copays, especially these days. I mean, it really is a wash.
Yeah.
I mean, in terms of dollar to dollar, but they're even further ahead by getting a return on their health investment by going through, individualized compounding, or, going through biohacking, cellular nutrition, or whatever their needs are. So right now, dollar for dollar, it's a wash, but yet it's still
long-term
return on your investment that's like multiplied.
Right.
Multiplied.
So Dr. Fadwa, as we wind this podcast up, tell us what you have a passion for.
I have a passion for this generation and the one coming up, for family lineages. Parents are tired and they're frustrated, and they're dealing with children who are stuck to their phones, stuck to laptops, being taught certain things at school they should not be taught, and they're feeling lost. And so my passion is to preserve family lineage, really, and get parents on board and partner with me and let me help your kid so they can thrive and become an independent adult.
I love that. So how do they get a hold of you to do that?
Do you have you can do my email if you'd like. I think I gave you all my links, but
yeah, well, go ahead and put that up there. And Julie, if you can stream her link, that'd be great. What's your most popular link that you'd like people to check out?
The Connect link, the KONET link. I think I have that for you. If not, you're welcome to email me at fadwa@applecrosswellness.com. All one word.
I love it. I love it so much. So thank you for helping us to realize our goal, which is to educate and empower individuals to take charge of their own health. I appreciate it.
Thank you for having me and tolerating my fast talk. I really appreciate you both.
Believe me, I love fast talk because I talk fast myself. So
thank you. Thank you so much.
Yeah, you're welcome. And thank you for being a pharmacist that's a pioneer on the cutting edge of helping people actually get healthy instead of just giving them another drug that makes them sicker.
Amen. Amen. Same here.
Yeah.
Thank you.
Yep. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Wednesday to our midweek podcast. I'm not sure who our guest is, but it's going to be a good one, 8 to 9 a.m. Wednesday, because we will be traveling to Australia Thursday. So we're not going to be able to do a podcast that morning. I'm super excited. Please follow us as we travel through Australia and educate and empower individuals to take charge of their own health. So thank you for tuning in to Health Solutions with Shawn and Janet Needham. Thank you.